again, nobody knows how to have intimacy. We're all winging it, we're all making it up. But my sort of bias is to think of one way of approaching couples work. It's not the only, is to start with personal responsibility as the necessary first response to the reality that I don't think anybody can come through out of their childhood established in personal responsibility. You're a child, you have to cue off of parents, you have to cue off your siblings, after teachers, the world. So all the first, 12 or 18 or whatever years of our development are organized around cueing off of other. It's not all of it, but it's the bulk of it, especially when things are difficult, because our young, powerless survival is there. So I think we come into adulthood very embedded, established in a style of looking to the other as if they are the location of both the problem and the solution, because that is the child's world. And if you have a fortunate childhood, you have more flexibility. And like we were talking about before, if it's difficult, you have more rigidity and expectations of harm. But basically, I don't think anybody comes into adulthood having yet really put integrity as a higher priority than safety and security. You can have counter-reactive formations like maybe I had when I was young. Say, I'm going to put my integrity first, but that was in reaction. It wasn't really choiceful integrity. So I see the first stage of relational work almost always to sort of start to tease apart or unglue the emotional fusion, the codependency, the enmeshment, whatever language we want, that everybody comes out of childhood with. You can't be parented without what we would call emotional fusion. You're 6 months old, you have to be emotionally fused with your parent, or you're going to really be in trouble. It's not that pathological. It's just, it belongs in the first few years of life, though. It doesn't belong when you're in your 20s. But those patterns get established. They're survival patterns, so we're not going to just give them up. Then they have to get challenged as adults. My bias is to start with challenging the inaccurate emotional fusion. Some other therapists focus more on starting with connection. I start more with the masculine energy, whatever we call it, of separateness as what makes sense to me to start with. But separateness is just half the story of intimacy. We want to work on our personal responsibility so that we can keep our heart open. We're not being personally responsible so we can say, well, fuck you, we'll each live our own lives and, No, it's like, I'm in this relationship because I want connection. I want to give and receive love. But if I can stop having this unconscious compulsion to claim you're the cause of my difficulty, so you should be the solution to it, and say, no, it sort of sucks to eat it, but if I really look at my life, I've had this issue all my life before I ever met my partner, So on a practical level, I often suggest people experiment with the view that any emotional reactivity is 100% one's own responsibility to work with, because almost certainly it's a lifelong core vulnerability. And so that we do not involve our partner and do not allow our partner to involve us, so to speak, with emotionally reactive energy. And instead, deal with our conflicts as practical issues using behavioral, negotiating, problem-solving thing where we just ask, hey, I have a request. Would you please put the toilet seat down? But from a ground of powerlessness. We can't control them. So it's my feeling to work with. But because we're in a relationship, our personal separate experience is not the whole story as we started off with. There's that overlap or you wouldn't have a relationship. So we have to also cultivate a wide variety of emotional and behavioral communication skills in terms of being clear, being supportive, kind, knowing when to have boundaries, when to relax our boundaries, on and on and on. It's endless, work to be more skillful in relationship. But I find that it's paradoxically safer or more practical to be emotionally close to one's partner if we are grounded in personal responsibility. So we know, hey, I'm going to take care of myself so I can get as close as I choose to this partner. And if there's a problem, I'll just step back. But if my partner is the location of my well-being, like in codependent or, relationships, then every step I take toward my partner, I'm unconsciously going to feel more stuck, more an extension of their needs. I can't say no because that will lead to loss of relationship and abandonment or attack or, things like that. So most couples, I think, actually are regulating themselves in the relationship to make sure that there's a guarantee of a certain amount of sort of ritualized distance in the relationship. And couples do that with usually some predictable things like chronic conflict or miscommunication, loss of sexuality, overfunctioning, underfunctioning, absorption at work, absorption with parenting, blah, blah, blah. But then that means that they're using these problems as a substitute for emotional separateness. They're getting the separateness from, sticking each other with the sharp stick, from backing each other off. And so most couples come into therapy with this fantasy that the problem is that they're not connected enough. We want more connection, we want more sexual passion, but they don't consider the possibility that it's exactly what they're avoiding by mutual consent unconsciously. And so if a couple can, however they do it, investigate, establish, cultivate a sense that I'm both connected and separate, and especially when there's conflict, I'm going to take the position of separateness. I'm responsible for my difficult feelings here, not my partner. When things are friendly, then we take more of the view of connection. Hey, it's fine. I'll not worry about my boundaries. I'll cut my partner slack. There's always this back and forth. It's like breathing in and out. It's not just one thing. And so if we can cultivate that capacity, I think, strangely enough, our unconscious investment in perpetuating problems starts to fall apart and dissolve. It's very parallel to what we were talking about earlier as far as struggle or self-absorption. If I can learn how to stay present and embodied and unconditionally kind moment after moment after moment after moment till I die, I don't need protection from life. I need practical protection, but I don't need chronic, unconscious experiential protection. Same with relationships. And so, again, my bias is to start with personal responsibility, as you were asking about, and that could be individual, but I think doing it in the presence of a partner often can clarify for each person what the other person is dealing with, and the fact that, oh no, actually I got it. This is their issue that's been with them all their life, and hopefully maybe even have a little bit of compassion about that. And in couples work, you can intervene if you're working as a therapist in this never-ending impulse to blame the other person for one's pain. If you're in individual therapy, you don't get that same provocation on the spot. So it's you can then translate that back to the relationship, but it's different. So often I'll suggest that people start with that personal responsibility, and individual therapy, if that supports that, great, whatever works. But we don't want to stop there. We want to also learn how to bring our personal presence into the provocation of an intimate relationship, which is very provocative. it's not easy. I think intimacy is probably about the most difficult thing most of us will do in the emotional realm. It's unresolvable. It's disturbing. It's going to guarantee to force out into the open any unresolved issues that we're carrying, basically, about relationship. And so I think working with one's partner in the same process actually can accelerate that work. And as maybe you saw in the book, I think not only is it helpful on the relationship level, but I think intimacy actually in our culture is one of the most powerful potential spiritual practices we can have, because it forces out into the open exactly what we're not wanting to feel, but is already there. And your intimate partner can get under your skin much better than a therapist can even.